This is the Emergency Medical Minute, sponsored by Health One.
So, interesting case. We had a girl who came in with kind of fever, sore throat, malaise, kind of upper respiratory symptoms. That's it. That's the interesting case. No, I'm just kidding. So what made her case particularly interesting, she had a history of something called congenital adrenal hyperplasia. So when I say the adrenal gland, what are some things that it makes or is responsible for? Open floor. Cortisol. So I heard someone say cortisol. That's 100% correct, and that's really important. So the adrenal gland has three kind of layers. It's this little triangle-shaped thing that sits on top of the kidney. And each of the three layers produces a vital component of life. So working your way from outside in, essentially, it is salt, sugar, and sex, okay, are the three bodily functions. It's part of your pituitary axis. It's part of your hormonal system. And the adrenal gland responds to a number of hormonal signals to create those hormones in the body and those components. So a patient who has congenital difficulties with their adrenal gland is chronically on steroids. So they need exogenous ways of producing cortisol, or otherwise they'll be unable to have your normal cortisol spike and normal blood pressure surges, blood sugar surges. There's a number of reasons you can have impaired adrenal function. One of the most common ones is a congenital condition called congenital adrenal hyperplasia, and that's due to an enzymatic deficiency called 21 hydroxylase. So it's less common now because it's on newborn screening in all 50 states. But essentially, that's an enzyme that's needed through a very complex series of pathways to produce both aldosterone and cortisol. And if you have an absolute deficiency, you actually can't produce your sex hormones later, and that comes into consequences in puberty. But we'll focus on the aldosterone and cortisol today. So aldosterone is part of your, kidney's way of keeping your blood pressure up. So your RAAS system, RAAS, renin-angiotensin-aldosterone system, is when the kidney says, I'm not getting enough blood flow, I'm not getting a high enough perfusion pressure, and if I'm not getting it, then nobody is. So the kidney sends signals to the brain that says, I need a higher blood pressure, and the brain, through a series of signals, uses aldosterone to ramp up the blood pressure and perfuse the kidneys, and therefore perfuse the body. So patients who are persistently hypotensive, unable to mount that normal sympathetic response and get their blood pressure up, a lot of those septic patients, that's because of the infection, right? So they kind of leaky capillaries and they can't keep their vascular tone. But another cause, and a less common cause, is adrenal insufficiency or adrenal crisis. So she came in adrenal crisis, and what that meant was that she was kind of sleepy, kind of lethargic, and she was hypotensive, 80s over 40s. She was hypoglycemic, sugar was in the 50s. And it was because she had not been able to keep down her home PO hydrocortisone that she takes on a daily basis. And so you have to replace what's missing in kids with adrenal crisis. So you have to give them a little bit of volume. You have to replace their salt because it's a salt wasting condition. So salt, sugar, sex. So they're hyponatremic. So you give them gentle resuscitation to get their perfusion pressure up, get their sodium back up. So she got normal saline. Then she got D50 to bump her sugar back up, and she was able to tolerate by mouth as well. And then she wound up getting admitted to the PICU because her sodium was 123. So she was profoundly hyponatremic, and it's all because she was unable to mount that kind of sugar and salt stress response that gives you your normal homeostasis with sodium and with your sugar. So adrenal crisis, kids, number of reasons you can have it. Another reason that your adrenals can't work is if you have bacterial meningitis, a particular kind, that causes a syndrome called Waterhouse-Friderichsen syndrome, which means you get meningitis and then there's ischemia of the adrenal gland and your adrenal glands no longer work, so you can't mount that stress response. So if they can't produce their normal kind of salt, sugar, sex response, then you need to produce that for them, and it can be a component, albeit an uncommon component of patients who are persistently in shock. All right, so that's a little primer on adrenal crises.
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.